So revision facelifts, really big topic because we see them all too frequently. There are too many things out there about facelifts. A lot of people are trying to do them. There unfortunately are just way too many gimmicks. So by the time the patients come to me in order to fix these issues, which are sometimes very difficult to fix, we have a lot more work ahead of us. So what are the common things that I see? Well, if it's not really a true good quality deep plane facelift, we're going to have some tension on the scars. So the scars themselves can be wider. If the incision was designed improperly, too far in front of the ear, or sometimes it just pulls too far in front of the ear because there's tension, that's going to be a tougher one to fix. The one that really gets me is where the incision that comes in front of the ear here does not go around the sideburn, but instead it's taken up into the hairline. It sounds like a great idea. Why don't we hide the incision up in the hairline? However, if you think about it, it really doesn't make sense because we're taking skin out. We're pulling all this mass and there's going to be extra skin. And especially if you're doing a pretty big advancement, if this incision is here, we're going to pull back this entire sideburn. So if you've ever seen someone with a very wide area here and the entire sideburn is pulled back, it looks very odd. Imagine shaving this whole area and having this wide. And I see this way too frequently. So for me, that's a very big no-no. The other thing is the classic pixie ear. So that is an ear that is attached. Some of us normally have an attached earlobe and that's fine. But in these cases, again, it goes back to having tension on the skin because the skin was used to pull, or it was a smash lift that ended up pulling back and now there's tension. It starts to pull on the earlobe and you see the earlobe almost continuing down with the jawline and it's all one. The other things are just classic failures where they've had a facelift, maybe sometimes even within the past year or two, and there's still a lot of jowling, or there's still platysmal banding, or there's still fullness. Those really come down to, most commonly, the procedure itself. Again, either just pulling skin, something that's a very quick lift that they were promised, oh, this is going to be a quick lift, you'll be done after the weekend, you're going to have no bruising, we're just going to pull this up. Sure, if you're going to do less work, then you're going to have faster recovery, but you're also going to get a worse result. Not only is it going to be a worse result, it can create problems that are much harder to fix down the line. So most commonly, we're doing deep plane facelift. We're taking all the tension off in order to avoid all of those problems like wide scars, pixie ears, alterations in the hairline, and many of those classic things. Nerve damage is another one that we sometimes see. Nerve damage is very rare, but it is possible. Most of the time it's very temporary and it comes down as a weakness, usually around this area in the corner of the mouth here.